This is Dr. Paul Firnhaber, and it's time for 10 Minutes of Truth, which means it's Wednesday, okay? So today I have an article from a journal called Biological Psychiatry. This article was published April 15th of this year. The name of the article is called Longitudinal Trajectories of Plasma Polyunsaturated Fatty Acids and Associations with Psychosis Spectrum Outcomes in Early Adulthood. First of all, I want to say that I'm pretty familiar with the journal Biological Psychiatry. I like the journal a lot. I used to cover their articles a lot when I had my radio show. And the reason I like this journal is because they really try to look at the underlying causes of psychiatric disorders rather than just throwing pharmaceuticals at the problems. So this article talks about psychotic events and psychotic disorders and at-risk mental status, and they look at it in conjunction with a person's fatty acid status. So why would they want to do that? Well, first of all, we have to understand that the brain is primarily made of fat. And so you have to have the right kind of fat in order for your brain to function properly. So this is a first assessment of plasma polyunsaturated fatty acids measuring across childhood, adolescence, and early adulthood in a large population general cohort. Plasma omega-6 fatty acids, the ratio of omega-6 to omega-3 and DHA were measured at ages 7, 15, 17, and 24 years of age. Outcomes were assessed at 24 years. So plasma, they measured fatty acids in plasma, which has the advantage of being less subject to degradation and greater stability in long-term storage. And plasma gives you the general composition of fatty acids over the last 2 weeks. The authors hypothesized that a higher omega-6 to omega-3 ratio and lower DHA levels would be associated with increased risk of psychosis spectrum outcomes. So what they're looking at, they're saying, look, if you have too much omega-6 fatty acids in your diet and not enough omega-3. Now, omega-6 comes from corn oil, seed oils, vegetable oils, things like that. If you have too much of those, you have a greater risk for having psychiatric and psychotic disorders. That's what the hypothesis was. So they used what's called a psychosis-like symptoms interview, and they interviewed these people, and they looked at mental status and psychotic disorders, and they looked at it at age 7, age 15, age 17, and age 24. Now, the omega-3 fatty acids you find primarily in oily fish, green vegetables, and of course your omega-3 fatty acid supplements. There is evidence that supports the association with low levels of polyunsaturated omega-3 fatty acids and psychosis. Your omega-6 fatty acids are generally very pro-inflammatory, whereas your omega-3 fatty acids are anti-inflammatory. So if this ratio is skewed, omega-6 to omega-3, chances are you're going to have widespread inflammation in your body, which of course spills over to your brain. The ideal ratio is 1 omega-6 to 1 omega-3, or even 2 to 1, 2 omega-6 to 1 omega-3 is considered very good. Virtually, there's hardly anybody in America that has that. I mean, most people are 20 to 1, 30 to 1, sometimes 50 to 1. So it's very rare to have that balance, because in our culture, in our country, people in our country eat so much fast food and so much processed food that's loaded with omega-6 fatty acids that it really skews that ratio. So in the brain, the most abundant omega-3 polyunsaturated fatty acid is DHA, which is postulated to have neuroprotective effects via modulation of the neuron membrane integrity, inflammation, oxidative stress, and what's called synaptogenesis, or the ability to regrow and generate nerve endings that grow towards each other. It's called synapses. In the brain, previous studies have provided evidence for association between polyunsaturated fatty acids and psychotic disorders. In fact, meta-analysis of other studies have found that lower omega-3 polyunsaturated fatty acid levels in people with schizophrenia and lower DHA levels in individuals with first episode psychosis compared to control participants. In a general population study, higher omega-6 to omega-3 ratios and lower DHA levels were associated with psychotic disorders in early adulthood. So this ratio is really, really important. So what they found in this study was that persistently high omega-6 to omega-3 ratios were associated with increased odds of psychotic events and psychotic disorders. These authors found strong evidence for associations of persistently high omega-6 to omega-3 ratios and persistently low DHA levels with negative symptoms at age 24. There is evidence for low-grade inflammation during and preceding the onset of psychosis. And that's a very important point, because what it's saying is that psychiatric disorders are associated with widespread inflammation in the body. And one of the ways to measure that is the omega-6 to omega-3 fatty acid ratio. And so if you can lower those levels of inflammation, lower that ratio to closer to 2 to 1 or 1 to 1, you can really help those people a lot. Deficits in brain hippocampal growth during adolescence has been associated with psychotic events. And N3 or omega-3 fatty acids really help with brain hippocampal growth. So it's really important that children get enough omega-6 or omega-3 fatty acids. What are they getting mostly? Omega-6 fatty acids. Why? Well, they're fed processed food, things like macaroni and processed cheese, French fries, things like that, all high in omega-6 fatty acids. Very, very low or very deficient in omega-3 fatty acids. So the moral of this article is this. Make sure you're eating the foods that contain omega-6 fatty acids. Oily fish, your walnuts, green leafy vegetables, and if you need to, take a fatty acid supplement, and by all means, stay away from processed vegetable oils. Never cook with them. Try and eat as little processed food as possible, and try and keep this ratio low. Now, there's some tests out there that we do that show what that ratio is. So if you're interested in that, or if you have a friend or relative that's having psychiatric issues and you want to find out what that ratio is, we can do that here in the office with a finger stick. And we can find out in about 3 weeks, 2 to 3 weeks, what that ratio is. So I think this study is very relevant and very important because we're dealing with the underlying cause of psychiatric disorders. So if you're interested in the test or talking more about this, I'm here at Lincoln Disc and Nutrition at 4535 Normal Boulevard, Lincoln, Nebraska, and our office number is 402-488-2220. So if you want to come in as a patient, you want to take the test, you can give Carmen a call, and we'd be glad to set you up for that. So I'll be here next week, next Wednesday, for another 10 Minutes of Truth. I'll see you then.